really kind of keying in on the affordable ones, and ended up coming across a list that had a number of different EMRs, and Waiting Room Solutions was on that list and was highly rated. Yes, when I contacted Waiting Room, I was able to see some of the features initially. Then, in speaking with the representative, he was able to get me a login to the system so that I could test drive it for a few days to determine if it was something that would fit my practice and my style of documenting. It sure did. It really fit the flow that I have and in my expectations of what it should provide for my documentation, as well as being able to be customized, and that was very important for me. In regards to with pediatrics, there's so many different things you ask in regards to the current medical history, the past medical history, birth history, as well as developmental milestones and other safety anticipatory guidance issues. And being able to customize those was very important, because there's certain questions that I ask that I wanted to be represented in the EMR, and Waiting Room Solutions allowed me to customize the lists and how I pick and choose the different things to get the answers that I want into the chart. It really streamlines it, because once I can get it there in the template, it serves as a guide for me to know what answer, to questions to ask. Sometimes, it's easy to get sidetracked during the visit with kids, and nothing goes as planned many times when kids come in. And so sometimes you get a little off track, but having that template there with the points customized allows me to get right back into my flow and to make sure I cover everything that I want to cover during that visit. I felt a patient portal was one of the most important features, next to being able to customize. And that was one of the things I was really looking at when it came down to picking the EMR that I wanted to use. Parents just like being able to have that involvement and that access to our office and to their record, to be able to ask questions. And it just really has served really well. I have families that are using it regularly to send us messages, and also gives them that ability to schedule their own appointments any time of the day. And they might not be able to call us, but being able to get online to schedule that appointment really puts some decision making and some more power in the hands of the patients and their families. Well, that's important. The certification is important in regards to meaningful use, because you want the EMR that you're using to be able to kind of guide you to where you need to make some changes, where the deficiencies may be when it comes to meaningful use, and to also, really be able to gauge how you're doing and your progress. And even in the way the EMR is set up, through the way it's formatted and the layout really ties into the meaningful use requirement. So having that certification is important. The billing module within Waiting Room Solutions is excellent, and was one of the selling features for the product, in that it was totally integrated with the medical records module. Within the same login, I can go from the charting, complete my charting, and I can go right over into the billing and create my claims and submit those electronically. And then when I get those back, I can, within the same system, I can go in and post my payments. It really allows me to see the big picture with the practice and see how things are coming together. and really helps me tweak things as I am just getting started in my own practice. Being able to really just see every aspect of it all in one place has been really great to have. And so yeah, that integrated billing capabilities is a big plus. The other system that we used at my previous employment was a large server-based system that seemed just a little cumbersome to me. Even in regards for my staff, there were separate software that was involved in the practice management and scheduling patients, and there was a separate for the charting, and then there was separate for the billing. So there were 3 separate components that had to be accessed independently. They communicated and they were tied in and integrated, but it made it really hard for my staff they had to log in every time into a different system to schedule a patient, and so that made it very cumbersome. That's why an integrated electronic medical record is really the way to go. In the previous system that I used, I did not have the easy ability to customize the templates. There was the capability to do it, and it was, when you got it to work, it was quite good. But if I was in charting in the software and saw that I really need to tweak this template a little bit, I had to log out of my charting environment, log in a training environment in order to customize the template. And the process itself was a little cumbersome to do, and then it was submitted to the IT department to approve and implement it and push it out into on the server so that I could access it in the charting environment. So then I had to log out of the template creation and log back into charting. So it was very cumbersome, and I had wanted to make a lot of templates and ended up making very few. The thing that stood out the most about Waiting Room was the complete integration of all the different modules, the capabilities that each module had. The patient portal it really separated it from some of the others as well. The others didn't have as good they didn't have a good patient portal. With the patient portal, I like being able to have all the information there for families. Not only is it just a portal, but it's an information site, and where I can post instructions regarding health issues, where they can access all that from one place. They can log in and schedule appointments and send us messages. If they have a question, it may be 10 o'clock at night and they don't want to call me, but they can get on the system and send me an email, and I can see that the next day when I get into work, to be able to answer them for those non-emergent issues. If they're able to schedule, then they can get that scheduled and go to bed knowing that they have an appointment the next day. Yeah, the fax queue allows the different laboratories that I use to send their results directly to our system. It gets, by going into the fax queue, it automatically gets entered into Waiting Room Solutions, and then it's just a matter of a few clicks where we can get that lab result connected with the patient record and be able to review it and sign off on it, and then we know it's part of the record. And the other way of doing it, you receive a fax on the fax machine from the lab, and then you have to scan it in, attach it as a document, and sometimes there's some difficulty in getting, you can get a scanned document in, but it's hard to get it attached to an order, where the fax queue really allows us to get it attached to an order that we've entered. Yeah, waiting room solutions has been great in regards to the customer service. I've been able to email and talk to the different individuals involved with the different areas, whether I had a billing question or a charting question. They were always accessible in guiding me. They were also helpful in guiding me through the implementation process to make sure I had everything in place that I needed. That all my questions were being answered. They were very interested in how I was doing, and that was really nice to have. Very reasonable. When comparing all the systems, waiting room solutions was right up there with the affordability. Now it wasn't the cheapest of the options, but it wasn't that far off. The flexibility would be great with having waiting room solutions being a web-based. I can access the system very quickly, just pulling up the web browser from any computer terminal, logging in, and doing what I need to do for the patient at that time. Overall, yeah, I do. Sometimes charting can be a time-consuming endeavor, and with the way the templates are set up, it really allows me to flow through and do charting quickly to make sure everything is captured and in a timely manner. Yeah, I used waiting room solutions from the first day, and had actually had a few weeks to have it running before I started. And so that way when the patients came in on that first day, I was ready to go. Charting was easy. It was easy to train my staff on the different features and what was needed for each visit. And so it really helped in having it right from the get-go. I didn't have to worry about, say if I started on paper charts, I didn't have to worry about scanning those in. It just makes sense if you're going to be starting a practice to get your solution, your electronic medical record, right at the beginning and use it from day one.